Monkeypox. The very word conjures up images of a distant, exotic disease. But for many, this perception is rapidly changing. The virus, once confined to remote regions of Central and Western Africa, has now reached global proportions. This alarming trend has left many wondering, could monkeypox be the next global pandemic? While the world grapples with the aftermath of COVID-19, the emergence of another viral threat serves as a stark reminder of our interconnectedness. We are living in an age where diseases can spread across continents with unprecedented speed. Understanding monkeypox is not just a matter of scientific curiosity. It's about safeguarding our collective health. The recent surge in monkeypox cases has sent shockwaves through the global health community. This surge has fueled anxieties and raised urgent questions about our preparedness. We must confront these concerns head-on, armed with accurate information and a collective determination to prevent history from repeating itself. Monkeypox belongs to the same family of viruses as smallpox, a disease that plagued humanity for centuries. While smallpox was eradicated in 1980, its viral cousin, monkeypox, persists. This persistence poses a unique challenge, reminding us that the fight against infectious diseases is far from over. Monkeypox was first identified in 1958 in research monkeys, hence its name. However, it's important to note that the primary carriers of the virus are rodents, not primates. These rodents, often found in forested areas of Central and Western Africa, can transmit the virus to humans through bites, scratches, or contact with infected bodily fluids. The virus, once transmitted to humans, can spread further through close contact. This includes contact with an infected person's rash, scabs, or respiratory droplets. Understanding these transmission routes is crucial for effective prevention and containment. While monkeypox is not as easily transmissible as some other viruses, understanding its modes of transmission is crucial. The virus spreads primarily through close personal contact. This includes direct contact with an infected person's rash, scabs, or bodily fluids, as well as contact with contaminated materials like bedding or clothing. Respiratory droplets can also carry the virus, but prolonged face-to-face contact is typically required for transmission. This means casual contact, like passing someone in the street, is unlikely to spread the virus. However, sharing a confined space like a crowded room or public transportation for an extended period could pose a risk. It's important to note that while monkeypox can spread through respiratory droplets, it's not considered an airborne virus like measles or tuberculosis. This means it doesn't linger in the air for long periods or travel long distances. However, the possibility of airborne transmission in certain healthcare settings where procedures generate aerosols is still being investigated. To understand the potential threat of monkeypox, we need to look back at its history. While the current outbreak has raised global alarm, monkeypox is not a new disease. The first human case was recorded in 1970 in the Democratic Republic of Congo. Since then, the virus has been reported in several Central and West African countries, often in remote villages near tropical rainforests. For decades, monkeypox remained largely confined to these regions, with sporadic outbreaks occurring in humans. These outbreaks were typically limited in scope and contained through public health measures like isolation and contact tracing. However, the current outbreak differs significantly from previous ones. This outbreak is characterized by a wider geographical reach, with cases reported in numerous countries across multiple continents. This unprecedented spread has raised concerns about the virus's evolving nature and its potential to establish itself in new populations. Section 5, A Pandemic in the Making, Assessing the Risk. The million-dollar question on everyone's mind is whether monkeypox has the potential to spiral into a full-blown pandemic. While the situation warrants close monitoring, it's essential to approach this question with a balanced perspective. Monkeypox, while a serious public health concern, possesses characteristics that distinguish it from viruses like COVID-19. Firstly, monkeypox is not as easily transmissible as respiratory viruses like COVID-19 or measles. Its primary mode of transmission requires close, often prolonged, contact with an infected individual or contaminated materials. This makes casual transmission less likely. Secondly, we already have a head start in combating monkeypox. Unlike COVID-19, which was a novel virus, we have existing tools at our disposal. These include a vaccine and antiviral treatments originally developed for smallpox. Section 6. Recognizing the signs, symptoms, and early detection. Early detection and diagnosis are crucial for containing the spread of monkeypox. The virus typically manifests with flu-like symptoms, including fever, headache, muscle aches, back pain, and swollen lymph nodes. These symptoms are often followed by a distinctive rash that progresses through various stages, from flat red marks to raised bumps filled with fluid. The rash, which can be itchy and painful, typically appears on the face, hands, feet, chest, abdomen, or genitals. It's crucial to distinguish the monkeypox rash from other skin conditions like chickenpox or measles. Consulting a healthcare professional at the first sign of any suspicious symptoms is paramount. Early diagnosis not only allows for prompt medical attention, but also enables public health officials to implement contact tracing measures. This is essential for identifying and isolating potential cases, breaking the chain of transmission and preventing further spread. Section 7. Prevention, our first line of defense. In the face of any potential pandemic, prevention remains our most potent weapon. Fortunately, there are several measures individuals can take to protect themselves and their communities from monkeypox. Firstly, practicing good hygiene is paramount. Regular hand washing with soap and water or using an alcohol-based hand sanitizer can significantly reduce the risk of transmission. Avoiding close contact with individuals who are unwell or have a suspicious rash is also crucial. Secondly, vaccination plays a vital role in prevention. While the original smallpox vaccine is highly effective against monkeypox, newer vaccines specifically targeting the virus are under development. These vaccines are crucial for protecting healthcare workers, close contacts of infected individuals, and potentially the wider public in the future. Section 8. Global solidarity. The key to containment. The monkeypox outbreak underscores the interconnected nature of global health. Viruses know no borders, and neither should our efforts to combat them. International cooperation and solidarity are essential for containing the spread of monkeypox and preventing it from becoming a global pandemic. This requires enhanced surveillance and information sharing between countries. Early detection and reporting of cases are crucial for triggering rapid response measures. Sharing epidemiological data, research findings, and best practices can help countries learn from each other's experiences and coordinate their response strategies. Equitable access to diagnostics, treatments, and vaccines is also paramount. Ensuring that all countries, regardless of their income level, have the resources they need to effectively respond to the outbreak is a matter of global health justice. Section 9. Staying informed, staying ahead. In today's hyper-connected world, information is our greatest ally in the fight against infectious diseases. Staying informed about the latest developments, guidelines, and recommendations from trusted sources like the World Health Organization and national health authorities is crucial. Misinformation can spread as quickly as a virus, fueling fear and hindering effective public health responses. It's essential to rely on credible sources of information, avoid sharing unverified claims, and consult healthcare professionals for any health concerns. Staying informed empowers us to make informed decisions about our health and that of our loved ones. It enables us to take appropriate preventive measures, seek timely medical attention, and contribute to a collective effort to safeguard public health. Section 10. Our collective responsibility. The emergence of monkeypox serves as a stark reminder of our shared vulnerability to infectious diseases. It highlights the importance of global solidarity, scientific collaboration, and individual responsibility in safeguarding public health. The fight against monkeypox is not just the responsibility of governments or healthcare workers. It's a collective effort that demands the participation of every individual. By staying informed, adopting preventive measures, supporting vaccination efforts, and advocating for equitable access to healthcare, we can all contribute to containing the spread of this virus. The choices we make today will determine the course of this outbreak. Let us choose to confront this challenge with courage, compassion, and a shared determination to protect the health and well-being of all. The future of global health depends on it.